Hi, everybody. Thanks for joining the panel here today. I'm Jason Elzy. I've worked in the affordable housing industry for over 25 years now. Presently, I wear multiple hats. Currently, I'm a board member of Access, Jackson County's community action agency. I am also a board member of Jackson Care Connect, a Jackson County-based coordinated care organization. Presently, I also chair the Continuum of Care in Jackson County, and that's where I've gotten my feet just barely wet in the topic that we're talking about today and has become an interest of mine. I also presently have the honor of being the president of the Association for Housing Authorities of Oregon. So working on a lot of things in a lot of different areas, and in my spare time, I'm the executive director of the Housing Authority of Jackson County. Presently, the Housing Authority serves about 4,500 households in Jackson County and here in Josephine County, as you heard earlier, through both our Housing Choice Voucher Program as well as our housing production and operations. Today, we're going to be talking about homelessness, and we're going to hear from some experts. We're going to hear about housing the homeless in Southern Oregon and the intersection of homelessness, mental and behavioral health care, and supportive housing services. When I saw the list of panelists and I was asked to be a moderator, I jumped on this panel because I'm absolutely thrilled to be moderating this panel full of experts, because not only have they been doing the work that they've been doing for quite some time, as you will hear, but I consider them colleagues, partners, and friends in all of this work that we're doing. And I've had the opportunity to work with them, crossing paths along the way, and as I said, they're the absolute experts when it comes to this topic. So let me introduce our panelists. First, we're going to go in order. To my left is Julie Akins. She's the Senior Housing Director at AllCare Health. Julie has more than 20 years experience as a journalist and has served as news director in network newsrooms around the nation. Julie also worked in the Center for Investigative Reporting on their California Watch project. She's written for numerous publications and taught journalism at Southern Oregon University and Emerson College. The focus of her most recent work is to chronicle homelessness throughout the West Coast. Her work has been featured on CNN, and she is a frequent writer and lecturer on the subject. Julie's partnership with AllCare Health, with the focus on Southern Oregon's homeless, has been ongoing since 2017. And with that, I'm going to invite Julie to talk a little bit about her work at AllCare and what is going on at AllCare Health in her agency.
Okay, I just want to make sure I work the mic correctly. That would be kind of ironic after talking about all this media experience and I couldn't speak in a mic. Can you guys hear me okay? All right, terrific. So thank you very much for that introduction. And yes, I come at this from a different perspective in that, to be honest, when I first started covering homelessness, I wasn't that interested in this subject. I didn't know that much about it. And the more I did a deep dive into the stories and in interviewing people with the lived experience, the more I discovered that this is not someone other than us, this is us. That we are truly a paycheck or two away from it happening to everyone in this room. And I'll go further and say that I think many of us working in the field have direct experience with homelessness at some point in our lives. And so I came at this from a perspective of intersectionality, what causes homelessness, who are the people most likely to become unhoused. And you know what? It's changed over the years, hasn't it? It's changed dramatically. And I think there are some misconceptions around what causes homelessness. And so I'm here to say, I'll quote James Carville, it's the economy, stupid. That's what causes people to become homeless. It's not a moral failing, it's a systemic failing that can hit any one of us at any time. some of us more vulnerable than others. And so what I wanted to do as I learned more about it was to destigmatize and decouple homelessness from morality. Not having money does not make you immoral. Not having money may make you a failure in a capitalist perspective, but it does not make you a failure in life. And so I started documenting those stories and talking to people living under bridges, in cars. I interviewed a woman who was worked in hotels and motels and lived under a crawl space in an abandoned house. And she worked full time, and so did her daughter. And that's where they lived. So I just learned a lot about it, and it grew my interest and compassion for the subject, and so I just stuck with it. And AllCare gave me the opportunity to do the work that I'd been doing on the West Coast, which was embedding in unhoused camps and talking to people and interviewing them with their permission and telling their stories. And every person I talked to kept saying to me, please keep going. Please keep telling our stories. Please let people know we're good people who had some things go wrong. And so I wanted to live up to that. And when AllCare gave me an opportunity to do that work with them, I jumped at it. And then 2.5 years ago, I got a call to come on board and work in the realm of being a housing director in the social determinants of health team, and to look at solutions for homelessness. And I've been at it ever since. It's a complex world, am I right? It's very complicated, figuring out how to braid funding and work with the state and get this work done. And Jason does an amazing job in our community housing people. It's phenomenal, the people that people and families that he has taken care of through his agency. And every person in this panel does an incredible job. So that's my introduction, and yes, I have a few opinions, so forgive me for that. And I'll turn it over to Mary.
Thanks, Julie. Next up is Mary Farrell. Mary is my go-to, as I have this learning curve about how to solve for homelessness. So I often say my background is in real estate development, and I know how to build boxes with windows and doors, but know very little about how to solve for homelessness. And so Mary is always very gracious when I send her an email or a text and have a new question for her. Mary is the founder and executive director of the Maslow Project. Mary graduated from SOU and began working with homeless children and families through the Medford School District in 2000. After working directly with homeless children and families for several years, Mary saw the need for a youth-centric one-stop resource center where kids and families could quickly and easily access essential needs and support services all in one location. Mary started the Maslow Project as a grassroots effort in 2006 and founded it as a nonprofit organization officially in 2009. Maslow Project has gained national and international attention and received numerous awards for its outstanding service and community impact. Mary is an American Leadership Senior Fellow and has served on numerous boards and initiatives addressing housing, children, and family services, civil rights, and as well as civil rights. Mary is currently a governor-appointed member serving on the Oregon Housing Stability Council. And Mary's going to tell us a little bit more about her work at the Maslow Project.
Thanks, Jason. So as you heard, I started my career now 26 years ago and working with children and families through the public school system. And the thing that I really learned through that boots on the ground type of experience is that kids have very little voice in how they get what they need, and really what they need is the same as every other kid. They need safety, they need security, they need to go to school with food in their belly and shoes that the sole doesn't separate from the top, and they need to have clothing that is hygienically clean and they don't stand out from their peers. They need to be accepted, they need to be connected to friends and to caring adults and to activities. I learned that it is really difficult, and especially back in 2000, it was almost impossible to get help if you were a young person. How do you get ID when you don't have ID, if you don't have transportation? How do you get a job if you don't have an address? And How do you get into school if you don't have a parent or a guardian to enroll you? So these are just sort of some of the challenges that motivated me earlier in my career to not just be the person at the public schools that identify and count kids and report them to the state, but how do we close those barriers, and how do we help engage these kids so that they feel hope and that they feel inspired to overcome some of the challenges that they have and continuing with their education. I can tell you just super quickly that a lack of a high school education is the #1 contributing factor to adult chronic homelessness. So oftentimes prevention doesn't really pay, and it's really hard to convince policymakers to prioritize prevention, and preventing homelessness is not only cheaper, it is more trauma-informed, and it yields better long-term life outcomes if we can stop homelessness from happening, or if we can intervene as quickly as possible and stabilize kids and families so that they can just go on with life and contribute the way everyone else does. So just also super quickly, in Josephine County alone, we have nearly 800 kids between the two counties that experiencing homelessness at one point in time throughout the year. And that is a really staggering number when you consider the overall population in this county. And that can look like anything from camping in their car, which is very common with families. They do want to stay off the grid. They are not looking to draw attention to themselves. Youth often on their own will be couch surfing. That's the more common way that we see unaccompanied kids out there. And most kids experiencing homelessness are homeless with their whole family. And so for many, many years, my biggest objective was to be a resource and help connect kids to what they needed to be successful. But it wasn't really until Jason became the executive director of the Housing Authority of Jackson County that our two agencies sat down and talked about how do we create home for these kids? How do we have that end stop where we are not just helping them survive homelessness, but we're helping them overcome homelessness and thrive? And since then, we have had many years now to live and learn together of what works and what doesn't work, and ultimately the successes that we see with our families and our children who we have housed through this partnership in both Jackson and Josephine County have just been tremendous for the trajectory of these kids and these families and what their life is like today as a result of being housed versus before we had this partnership. So hopefully I can provide some insights to like how to make that work as time goes on today. All right, thanks.
Thanks, Mary. Next up is Melanie Doshier. Sometimes I think I'm working for Melanie because of our involvement with the COC and partnerships between Access and the Housing Authority. We have certainly ramped that up in the last couple of years, particularly through wildfire recovery and housing people. And it's actually been a huge pleasure to work with Melanie and her team. Melanie is the Chief Human Service Officer at Access, Jackson County's Community Action Agency and lead agency of the Continuum of Care in Jackson County. Melanie oversees a multi-divisional department dedicated to housing stabilization, which she leads with a focus on trauma-informed, people-first wraparound care. She has extensive experience in program development and implementation spanning various industries. Melanie is a firm believer in the power of trust within relationships for effective support service models and is passionate about equitable access to resources, advocating for everyone's right to move forward in their housing journey. Melanie embodies the principle that access to housing tailored to the needs of all households is essential for communities to thrive. And with that, I'll turn it over to Melanie.
Thank you. Hi, everybody. Thank you, Jason. I oversee Access's programs that are aimed at housing stabilization. As Jason mentioned, I think one of the things that I want to talk about beyond the programs that Access administers is our role in the continuum of care. Access is the lead agency of the COC, as well as the Community Action Agency. What that means is that we get funding that either from the federal or the state government that flows to Access, and then we distribute amongst community providers that are a part of the continuum of care. Continuum of cares are a HUD-required entity that are comprised of nonprofits, service providers, people with lived experience of homelessness, government agencies, housing providers, and other organizations. COCs are designed to convene these partners that have a vested interest in ending homelessness and deliver housing and housing services to people who are experiencing homelessness. I think one of the things to talk about, I think both Julie and Mary have mentioned that homelessness response systems are really only exist because other systems have failed to provide the services at the time the services were needed. Mary talked to prevention, and I think that that's a really critical part. When you look at homelessness within the state of Oregon, the two largest populations, growing populations of subpopulations that are experiencing homelessness are families with children and seniors over 55 that are experiencing homelessness for the first time. Jackson County has done a lot of work over the last several years, probably 3, to restructure and re-envision the way that we are going to take what HUD designates we do with the Continuum of Care program and try to model it to best serve the people that are within our communities and the people that are needing our services the most. One of the things that I want to talk about is what a coordinated entry system is within a continuum of care. Coordinated entry system is really an access point, or it starts at an access point where people who are in need of services are able to go and get assessed and put on a list. What we do with that list, and that is one of the 3 kind of legs that HUD requires a continuum of care do. From that list, the idea is that all of the providers that have services available will come together and talk about the people that are experiencing housing instability and homelessness within their community and connect them to the resources that they need the most. I have been in this work for some time in Jackson County, and over the last 6 months was the first time that we have successfully filled program slots and got participants housed through coordinated entry system. Within that system, we have our local CCO, Jackson Care Connect. We have a lot of population-specific providers. We have behavioral health providers. We have medical providers in there that are all contributing their experiences that they've had with the people that are in this list so that when they do get connected to that case management and get into housing, they have the other supports that they need to stabilize in that housing. I think another thing to make sure everybody is aware of is that when people have been experiencing homelessness for a long time, it's actually when they get into housing is a point in time in which they really need the most supports as possible. Living inside is very different than living outside. And there's also a real desire to share resources with the community that's been supporting you through time when you do get into housing. And so you see stories of people getting into housing and then blowing out of housing, and it's really because they don't have the right supports to understand how to do that successfully. A lot of the skills that we have as humans on this planet are taught skills. They don't just show up with us in our bodies when we show up here, and understanding the supports that people need to learn those is really, really important. I also think that there is a real need to consistently be evaluating your system to ensure that you have the right players, the right people that are contributing the services that they have in that space. I think another thing is looking at your policies and to ensure that you've got the right, that the policies that you have within your service area or the providers that are there are really getting at the populations that are in need of the most. So I really thank Jason and everybody on this panel and everybody that contributes to the Jackson County Continuum of Care for being willing to really interrogate the way that our system is set up to make sure that we are targeting those that really are the biggest growing populations within our community. I think that also my personal ties to this valley are deep. I've lived here the vast majority of my life. I was born in Williams, Oregon. I lived there until I was in the 6th grade. My parents, we still have property out there. Then I moved to Ashland and went to high school there. Moved up to Portland is where I really grew my experience in policy and program development, and have been back in the Rogue Valley since 2019. This valley is near and dear to my heart, and to see what people experience here is devastating, and I am so proud that I get to be a part of creating better experiences for people in this valley to thrive.
Melanie, thanks so much. Next up is Sam Engel. I think I've known Sam for over a decade now. We have worked together in many capacities, and Sam has worn many hats and has held many roles in this community, which is, I've grown to appreciate his experience and insight by holding those roles. Sam is currently the executive director of Rogue Retreat. Rogue Retreat meets individuals experiencing homelessness right where they are, offering immediate stabilization through shelter and a housing-first approach. Rogue Retreat's services include providing shelter, peer support, case management, and job readiness. Sam has worked in the social services sector in the Rogue Valley since 2007. Prior to his current role, he worked at the Southern Oregon CCO AllCare Health as the Social Determinants of Health Director, where he partnered with Rogue Retreat on healthcare and homelessness issues. Prior to his position at AllCare Health, Sam served as the director of the Josephine County Food Bank. Take it away, Sam.
Well, thank you. Many roles and many hats is the nicest way of saying can't hold a job I have ever heard. And when I got started in housing, Jason was one of the first people I called to say, what do I do? And the answer is still, Jason, what do I do? Rogue Retreat has been around since 1998, and it started as a high barrier program. The initial programs were group housing for folks who were in recovery. They had to be sober and have enough income to live in the house. We still run those programs. They're called Havens. We're actually opening a new one on Monday we're very excited about. That'll be our first program where we have co-ed couples. Well, they don't have to be co-ed, but it'll be a co-ed housing designed for couples. If you have specific questions about that, Paul and April back there, who are going to put their hands up even though they don't want to, they know the answers to all of how that's going to work. Rogue Retreat is really a case management program. We do housing, we do shelter, but what we have always done is case management in those spaces. Because the goal isn't to warehouse people. The goal is always to, like Jason said, meet people where they are, and then help people take those next steps, identify their path, and then have staff members who have their own lived experience helping people along that journey. Our staff members are mostly traditional health workers, peer support specialists, and case managers that have been through the peer support training through the state. I land on that because the word health is really important in the work that we do. If you're familiar with Maslow's hierarchy of needs, everything starts with safety and basic needs being met. That happens in housing. Everything else that needs to happen along with that needs to happen in a safe place. And then having our staff trained on how to make it about your journey and not the path that got them into stability is a very important piece of our model. We added low barrier programs in 2016 and 2017 through winter sheltering, and then we added other low barrier programs. And in this case, if you're not familiar, low barrier it means you can come in, you don't have to have income, you don't have to have identification, you can have pets, with as few barriers as possible to getting you out of the cold and off the street and into a safe space. And then begin that journey from there. We added the Crossings Urban Campground in 2020, and then we expanded low barrier services in 2023, including adding medical respite. What Rogue Retreat is not is a clinical program. We don't do physical health ourselves. We can partner with other agencies to come in and do that work. We are a type of behavioral health, but we work with other behavioral health providers to come in to do that work as well. We're definitely not dentists. And so again, like in terms of the broad spectrum of collaborating around these services, we have to work with other people in order to get this job done. And I kind of struggled with exactly what to say about collaboration. The short answer is yes, nothing gets done without working together. I could go into a long, nuanced explanation of how we try and braid state funding to get things done. But because you seem like nice people, I won't. The real answer is that the collaboration is about the value that's being provided. We show up at work every day because we know the value of the work that we do. Our guests and our clients show up every day because they are benefiting from the work that we do directly. The folks that fund us also see value in the work that we do. Whether that's healthcare, recognizing that a $100 a night hotel room is a much better investment in somebody's care than a $1,200 a night emergency department bed that they don't need to be in. Or that's a city recognizing that we have a value in tourism. People are staying with us instead of staying downtown or staying in the park. Or that's law enforcement, recognizing that when they interact with somebody who would like to make a change in their life, it's much better to be able to offer them a bed tonight than to punish them for being too poor to sleep in a bed tonight. And that's the way that we've seen our programs really evolve and develop, and that's the reason we're able to have about 500 people every night under our roofs and in our beds. We serve about 1,200 individuals a year. And then I want to add another example of tangible results. We have been running the medical respite program for about a year. And the way that that works is if you're having a medical crisis and you go into the emergency department and you need a safe place to discharge and you need a safe place to recover. That's not the street. Nobody should be homeless. And especially if you're recovering from wound care or something else, you need a safe place to go and be in a hygienic environment. But you don't necessarily need to be in a hospital bed. So you discharge to either the Kelly shelter or the Redwood Inn, where you can recover safely for up to 90 days until you're ready to move on to the next step. We've served a few over 300 people in that program over the last year. 47% of those people, over 150 people, have safely moved from that program into more stable shelter or more stable housing in 1 year. And that's 150 people who didn't discharge back to the street. And most of them didn't end up back in the hospital as a result of that same injury persisting. Yeah. Thank you.
Thanks so much, Sam. From here, we're going to go into a couple prepared questions, and I'm going to be mindful of the time. In fact, if somebody wants to watch the clock for me a little bit, I would like the last 20 minutes. We're going to call this good at 2:30. But the last 20 minutes, I'll call on the audience to ask questions. But until then, we have a couple of prepared questions for the panel. Question one, that was a great segue, Sam. Question one is about collaboration and community engagement. Providing homelessness services does not succeed in a vacuum. Success requires building working relationships and collaborations with governmental jurisdictions, schools, healthcare providers, other nonprofits, and community engagement. For the panel, the question was what has either worked for you or what were barriers you experienced when engaging with local government jurisdictions and or residents during the process of developing and getting your project or programs off the ground?
There's so many answers to that question. Obviously, as a CCO, Coordinated Care Organization, we don't do anything without collaboration. That's the whole ticket. So we work with Medicaid funds that come through the state, through the Oregon Health Authority, and through all of the various sub-organizations within that. And then we pass that funding through to organizations like the three others sitting here at this table. And that collaboration makes all the difference, because pushing that money out means that a kid gets housed, a family gets housed, a person gets stabilized coming out of the hospital. So it's all about the coordination with community-based organizations working in tandem with the state. So there are numerous success stories, things that I think AllCare Health and everyone at this table are really proud of. And all of us work together frequently in terms of funding and programming. I can think of some unique programs throughout the state where we worked with organizations that helped people who live in mobile home parks buy the land underneath their mobile home. And it was a phenomenal program. We were able to help 3 different mobile home parks become community cooperatives, and they own the land. That, in one generation, takes care of a lot, right? Because they go from being owning just the mobile home to owning the land underneath, and then they can will that to their children, grandchildren, and so it goes. So you create that intergenerational wealth in one shot. So there are a lot of innovative programs that we've been able to work with and have been very excited. Some of the barriers come from the idea that it is very difficult, in my experience. Now, Jason has a different experience in terms of working with the Housing Authority, and there's a lot of really good information about how to build new housing through the Housing Authority and through other groups. But as a CCO, one of the things we run into is it's very difficult to actually get money to build new housing. And homelessness is a housing problem. We don't have enough houses. We certainly don't have enough accessible houses for people, just regular working people. So that's been the biggest challenge, is trying to figure out how to get funding to build new housing. In addition to that, there are some challenges working with individual communities. I live in Ashland, and there are some difficulties in getting around the planning in different communities to build accessible housing, in different housing types also, because I think there's a sort of a perspective, and I get it. We all sort of want the 3-2 on the quarter acre, right? I mean, that's sort of the American dream of housing, but that we may need to re-envision that. We may need housing that's accessible, that looks different than that. And so I struggle with that in terms of collaborating with local communities to have different housing types to make housing more accessible. So those are some of the challenges and some of the advantages, and I think the rest of the panel can speak more specifically to that, but in a overview, broad brush strokes, that would be my answer.
Thanks, Julie.
Okay, I am going to answer that question, but sometimes when you do the same job for 26 years, your brain just forgets, like, I don't know, to tell you what we actually do. And so that is maybe some of the successes of the different collaborations that we have, especially with the other organizations here. But so Maslow Project is a nonprofit organization that works with specifically unhoused children and families, or families that are at risk for homelessness, in both Jackson and Josephine County. We've been in Josephine County since 2016, and we've been in Jackson County since 2000. And we offer school-based programming that's really targeting kids who have either dropped out of school or are at risk of dropping out, or are in school but just sort of need barrier removal to stay engaged. That program is exclusively built on years and years of trust with our local public school districts, and doing that education and helping them see that we share their benefit, or we share their goal, and a sort of mutual benefit to the students is the 92% average graduation rate we get with our roughly 70, 80 seniors every year. So if we're able to help them understand that by allowing us to work in their space and allowing us to have access to their kids, we are helping them improve their graduation rates, then they see that as a benefit to them. We also, because we want to be wherever our clients are, is we provide outreach, and that is sometimes just throwing on backpacks and walking in public spaces where people might be. I would say that's more so in Jackson County than in Josephine County, but in Josephine County we do mobile outreach, and we basically have a mobile resource center that takes all the food and supplies, but also qualified community health worker case managers in both English and Spanish that can go out into the more remote areas of our 2-county region, and really, if that's what they need in that day, is to connect to Oregon Health Plan or SNAP benefits, or they need to apply for housing, we're able to do that through our mobile unit. We've got Starlink, so we can just you know, if whatever they need, we can come to them or they can come to us. And then we also have 2 drop-in centers, one in Jackson County and one at the campus that UCAN is also at here in Josephine County, and that's more of a drop-in style. And similar to what Sam described with Rogue Retreat, we all provide sort of this plethora of case management services that really start with stabilizing people, helping them identify what their needs and their goals are, and then sort of walking alongside them. I always joke that we're sort of like the urgent care for the population we work with. But specifically to housing, and I think what is significant is that since our first partnership in 2019, we now have like 70, 80 something permanent supportive housing units. But beyond that, we have housed hundreds and hundreds of families by helping them to not only find affordable housing, pay for the deposit and the application fee, and then support them in affordable housing through different contracts with DHS, through our Jackson County COC, in the Oregon Rehousing Initiative, and then also just through OHCS with our YEHA funding, which really helps provide ongoing rental support for families with children in the K-12 system experiencing homelessness. And this year alone, we have already housed 167 households. So that is a huge number, and that's a huge, huge accomplishment from where we were even just a few years ago with really only helping to house a handful of families a year. And I think that the reason that that is successful primarily is because of how much time and energy we put into educating our community partners, our city officials, our elected officials, and specifically working to maintain and build and sort of preserve trust with our partners. I think I have known members of our Jackson County Housing Authority for so long, and we intentionally keep that trust and that relationship strong so that if they have a problem with one of our tenants, they have no issue calling us and saying, hey, we need your attention on this. Or if we are saying, hey, we've submitted an application 8 months ago and nobody's addressing it, we can pick up the phone and have that conversation. And I think that trust is what allows us to continue to add more units every year, because they know that we're not just housing these families and walking away. We're staying with them to ensure that they're developing the skills they need to be successful renters. Like I think maybe Melanie said, people don't always know how to live inside after they have been living outside, or to live next to neighbors. And like, oh, now I have a noisy dog that I have to deal with. Or there's just like dynamics of group environmental living that sometimes takes a little bit of adjustment. And also just important to know that when people have been unhoused for a period of time, it can take up to 24 months for people to de-escalate and kind of come out of survival mode and fight or flight, if you will, to really start to think about like, oh, now I need a job, or I need to take care of that health issue that's been lingering for years, or I need to get my kid back into school and engaged in different youth development activities. So we sometimes don't see those milestones in the first year. And so just to have that trust with a housing authority where they know we are working on it, we're committed and dedicated to supporting those families. We're not just like, we're not taking it for granted. We want them to be successful, but we also want the housing authority to be successful. And so if we can help them by preserving their properties and have good tenants, then they are also helping us keep those tenants housed and provide that long-term stability. So relationships, I think, are the key to our success, whether it's our outreach, whether it's our schools, whether it's our housing, because I think that's what then gives people trust and faith that we are getting outcomes, we are being respectful of what the different concerns are, we're hearing that, and then we're working together with solutions and including our participants in those solutions.
I was going to start with outreach to talk about successful programs, but Mary took that. So I will just reiterate the importance of outreach and building relationships with the people that may not be ready to engage in services now, but over time will, once they understand the trusted relationships. I think I said last time, and many of us have said, that systems have failed people. People don't individually put themselves in the situations that they are in. So it can take time to build that relationship to understand that this person or this agency will continue to show up. Jackson County was wildly successful with the executive order that came through, the executive order on homelessness. We were able to blow the goals set by the governor out of the water. In fact, they increased our goals twice because we were so successful. And we were successful because everybody within the COC had deep relationships with each other. If there was an issue that Mary heard or Sam heard or Jason heard about something that was going on in one of the programs that I oversaw, they would call me. And we would be able to walk through it, that all the conversations were never about an individual problem with a person. It was how do we solve for the issue that's at hand. We have very difficult conversations with each other, and we walk away with a better understanding of the shared outcomes that we have. I think that because of that, we continue to deepen the strength in our continuum of care and are willing and able to take on bigger projects that are going to better serve Jackson County over time. Relationships really are at the root of everything that we do, and the only way that program development will be successful, in my opinion. I think that some of the challenges around or barriers is complexity of funding. It can be very difficult to get funding streams to work together so that we can have effective scatter site permanent supported housing, or so that we can ensure that medical systems can fund housing with OHCS dollars. I mean, there's all of these rules at a state and federal level that make funding mixes really, really difficult to work through. And then at the end of the day, those complexities trickle down to the people that need the support services the most. And it was spoken to in the last panel about once people get to the place where they're able to fill out an application to gain access to resources, the application is so incredibly complex that you need a doctorate to be able to understand how to fill out the information. And that's like, we've got to do better for the people that we're here to serve. So, and if we can break down those barriers, it does have a positive impact on the entire community, because once people gain stabilized, it can take years, sometimes more than one, sometimes several. They can start contributing, which generates more taxes, which makes the whole ecosystem more effective for everybody that's involved.
Thank you. Yeah, so ditto to everything. And so what works and what are the barriers? Trust and risk are what works and what the barriers are. When Rogue Retreat started Hope Village in 2017, it was initially perceived that it was going to fail. We had to put a $25,000 deposit down because the assumption was we were on a piece of city-owned property. The program was not going to be successful. It was a low-barrier, non-congregate shelter model, and that we were going to prepay for the cleanup. So 6 months later, it was fine. The city returned the $25,000 to us, and then after a year, asked us to double the size of that village from 14 units to 28 units, which happened over the following year. We now have 140 units of village-style housing. 60 of those are low barrier, 80 of those are a higher barrier model. And that wouldn't have happened if multiple agencies in the community, businesses, the city, other individual funders, healthcare, if they hadn't been willing to try something different. Because if you're not investing, if you've got a problem and you're not investing in changing that problem into something you want, then you are continuing to invest in keeping the problem exactly the way it is. And being willing to take a risk on a change is, it's scary. And it should be scary, especially if you are responsible for taxpayer dollars and having to fill out reports to the state or other agencies at the end of the year. So taking that seriously, knowing who you can trust, and then deciding how you're going to approach that work. And the same is true with the folks who come into our program. We're strangers. Street outreach is incredibly important to invite people in, help people understand what they're getting into. But if you go stay in a hotel, you probably look at like Yelp reviews or whatever reviews. to see, stars and rating and whether the pool was cleaned. Folks are going to come in, they might stay with us for a night, they might stay with us for 3 years. And it's good for them to know who they're trusting because they're trying to make those changes in their life. And I think that that's reflected at every level of the work that we do and at every level of our various organizations.
Jason, can I add one comment?
Yes, please.
Okay, I just want to tell a quick story to sort of illustrate where barriers sometimes are. And I think both Julie and Melanie and Sam have all talked about this, but just community attitudes are often the barrier and sort of lack of understanding about who these, especially with, I think this is true with the entire population, but there is no two people experiencing homelessness that have the same story or the reason why they got to that place. And I think it's true that most people are a paycheck or two away, or if they didn't have that family support person, they would be in that situation. But one girl in particular we worked with a few years ago, through no fault of her own, through a lot of family dysfunction, she ended up as an unaccompanied youth at 16, and her 14-year-old brother was her now responsibility. And through a lot of work, she ended up getting into a transitional housing program for young people. She graduated from high school. She was Oregon Teen USA that year, and so pageantry was one of the things that sort of helped her engage and give her purpose, and she used youth homelessness as her platform, and so she became a spokesperson for other kids in her situation. She went on to get a 4-year degree from OSU, and she actually has a degree in pre-med, but 3 years later, she is working at a shelter up in Portland for other young kids because that's how strongly she felt about kind of going back to her roots. And the thing that she said to me that really illustrates where barriers are the most is when she was struggling to take care of her 14-year-old brother and go to school and pursue her own, life goals, she was really struggling with just the school accepting the dynamic of her family situation, and there was a lot of attitudes that she experienced that she felt were sort of holding her back. And the comment she made will stick with me forever, and she said, I'm a kid, what bridge did I burn? Like, she didn't do anything to cause those attitudes and those beliefs that somehow, because she was in an unhoused situation, she therefore also had behavioral issues and all these other things. And so the what bridge did I burn as a child? I was a child. That is just, to me, like a really clear way to illustrate where barriers exist from just ideas.
We're kind of hijacking this because I want to jump in and say something as well. I think that the conversation around being homeless, every time I have this conversation, almost without fail, someone will immediately start talking about addiction or behavioral health or mental illness. And I'm here to say that is not the same conversation as being homeless. We need to find a way to decouple this. And let me give an example. University of California, San Francisco, I think it was it 3 years ago, they had this brilliant study, and they debunked this idea that you become homeless because you have an addiction. What actually happens is that you become homeless, and then you may use substances in order to cope with your homelessness. And they use the example, and it really hit home to me because I'd interviewed so many people who told this same story. You have to stay up all night long because you don't have a safe place to go to sleep. Your shoes could be stolen off your feet. The police could come at any moment and roust you, and then you would lose what you have. So people would stay up all night long, and sometimes to aid them in doing that, they would use substances. So think about that. You've lost your stability, you've lost your home, you're being judged, and you have to stay up all night long in the middle of this trauma, scared to death, and someone tells you the reason that this happened to you is you made bad choices. Just had to say it. Thanks.
Actually, Julie and Mary, thank you, because that kind of segued me into our next question was going to be about narrative messaging and telling stories. But we just heard two very powerful stories. So with that, I'm guessing that you all may have some questions, and I'd like to find out what your questions are and let these experts see if they can't answer them. I've got a microphone up front. And there's also a microphone in the back, so if you have a question, don't be bashful, put your hand in the air. Otherwise, you're going to have to listen to me ask questions. Thank you.
This isn't exactly a question, but I just wanted to emphasize that I really appreciate the talk about collaboration. I'm a CASA for Josephine County, so I represent children who are being removed because of abuse or neglect or in foster care. And it should be noted, I think, that the primary barrier to reunification of children with their parents for kids who are being removed because of neglect is the inability of the parents to provide a safe and stable home. So homelessness is a huge issue in the child welfare world, and I assume that the collaborations that you describe include child welfare, and that we are all on the same page with that, because it's really sad to see kiddos who really want to go back with their mom and dad, and this is the barrier that they can't overcome.
I would just like to add to that involvement with the child welfare system is also present in 60% of the population that experience chronic homelessness. So to Mary's point about the importance of prevention, getting upstream will absolutely impact the experience of our future generations around homelessness.
And kind of to, I guess, points that were made earlier too, we did a survey of a lot of our guests last year, and 30% of our guests had been foster engaged. And so, especially when people are being, I'm just gonna say judgy, when people are being judgy about people, remembering that the adults that you're looking at today are kids that systems failed yesterday, and that investing in our kids now is a great way to help our adults of the future. So, thank you.
Just speaking quickly to the child welfare involvement, one of the things that I think a lot of people don't realize in our housing authority partnership is that the funding for the case management and the ongoing support actually comes from DHS, and it is funded by child welfare in an effort. These are previously system involved or in some form like supported by DHS, and so the objective is that then the supports that we're able to provide in that stable housing keeps these kids from going back into the system. And I think over 40-ish of our units are funded that way, and to my knowledge, none of those kids have been returned back into the foster care system. So that is a priority that we are definitely looking at. Yeah.
Thanks. I'm Bart Grady with Columbia Care Supportive Housing. And just a quick question, we have folks that are in our intensive supportive housing program whose participation in that program requires them to be on OHP, either with AllCare or with JCC. And we have folks that are losing their OHP for reasons that sometimes aren't entirely clear. And so we're curious about perhaps the best way to get them reinstated or get them to be put back on the rolls so that they can still qualify for those housing programs.
I don't know if it's an option, but I know in our organization we have employees, including Brandy and Matt right there at your table, who are OHP assisters, and so you can get your employees certified to be OHP assisters, and then they can be not only tracking the member enrollment and how, like whether they're active or if they're lapsed, and then they can help re-enroll them to keep that covered. And so that is a really beneficial thing if that's something you guys can do.
Do you guys have a plan about how to deal with family separations? We already saw in in the administration of the current president, the prior administration, there was a lot of kids left behind because either they were in mixed status families and their parents got removed, or because their parents decided to leave them with family members because they want a better life for their kids. So those kids become homeless. What is there a plan, or you guys already done this before? How are you gonna help communities or kids specifically, but communities in general, but kids that are going through the immigration system process with or without their parents, to be able to stay housed or have shelter?
Do you want me to take that? Okay. So that does happen, and we do roughly 35% of the 3,000 individuals that Maslow Project supports a year are Spanish speakers, and then you can sort of deduce that a number of those have had immigration issues, enough so that we've committed to roughly a third of our staff that are now bilingual, bicultural, and have become experts in navigating that situation and out of necessity. So the good news is that, you know, we are able to help point them in the right direction and support them while they're trying to figure out their long-term plan, but we also can provide a lot of stabilizing supports in whatever fashion that sort of safety plan is. So we do a lot of safety planning with families. We work in a world where a lot of our youth have non-legal guardians, and so if that's like an aunt, an uncle, a neighbor, a friend's mom who took this kid in, that happens all the time. And so on our end of the spectrum, we would work with them the same we would work with that whole family if the whole family was still here. And I know that our employees who work in that space more often would have a lot more to say about what it is they actually do. But we're also pretty careful about how we outreach to that population so that they know that we are safe and inclusive and here to support all of our people who need our help. And so we tend to get a lot of requests for that.
I guess I was just going to also say outreach again. I know that Mary's agency does a great job with their school-based systems, building the relationships with people, with the students that need help, that may need help in the future. So there is a trusted entity to go to in those situations. And I think that just the connection with outreach into the relationship is so critical to help address what you're talking about.
I guess just back to the collaboration piece, we cannot serve unsheltered youth, and so we would call Mary because Mary's the expert in this.
Hi, I know Sam mentioned that, oh my God, Rogue Retreat, they use peer support specialists. And Mary, do you have peer support specialists at Maslow?
We have QMHAs and community health workers. And we do have a couple of peer support, but our primary isn't peer support. That would be more of Rogue Retreat's model.
Hi there, my name is America Silva. I'm from Senator Wyden's office, and I've worked with all of you, have met with you in some capacity. And I'm lucky enough, being a field rep, I cover Jackson and Josephine counties, so I come to you to say, hey, what are the issues? Where do we need to support on the federal side? You know, where can my boss be more vocal, et cetera? And it's kind of going back a little bit to the storytelling, and I know that you might touch a little bit on that, but we in this room, I think, are lucky enough to be in certain positions where we can intake that information, but we have an idea, right, of where maybe homelessness can start, addiction, et cetera. How are you sort of doing that outreach with community, or how can we be better about destigmatizing these types of issues? You know, if you mentioned, Mary, the the young woman that experienced that through her school. And if they're the first ones that are trained for child services, you know, reporter, it's tough if they're already receiving judgment there, then they really don't have much hope for folks that, you know, aren't in this room and they're sort of looking at the news and taking that, so, yeah.
I'm going to jump on this one. Hi, nice to see you again. Please ask Ron to meet it at scale. That's the biggest issue, and it creates more stigma. If you have 20,000 homeless people and you build 200 units, and then people say, well, we spent all this money and there's still homeless people, so obviously housing doesn't work, right? That happens so frequently. We've got to meet it at scale. So we really actually have to talk about systemic-wide solutions. So that would be one thing. The other thing is realizing something about the lives of older people, people 55 plus. We're talking about people who don't have enough money to keep up with their rent on Social Security. It's just not enough. And I'll give you a lived experience, if I may. I have a friend, her name is Maria. I won't say her last name because I didn't get her permission to do that today. But Maria is 73 years old. She was my neighbor. Her Social Security is roughly $1,000 a month. Her daughter used to help her pay her rent. Her daughter is a journalist, oddly enough. That's how we became friends. Her daughter lost her job. Maria lost her place to live. Maria became homeless. Maria became sick when she became homeless. She had an injury. She moved into a skilled nursing facility. And I'm telling you, this just happened. She called me watching the news all day long in her room, and she said, if they cut Medicaid, I will be kicked out of this skilled nursing facility, and if I get kicked out, I've been hoarding pills, I'm gonna take my life. So these are true experiences of people. Again, what did Maria do wrong? She raised 2 children, she worked in her community, she worked as a caregiver, she worked as a caterer, she was on the PTA, and now she's talking like that. So we need help, we need money, we need boots on the ground, we need money for housing, we need barriers removed from building housing, and we need help for our kids and our seniors. They don't have enough money to survive on Social Security.
I'm going to add 2 things. The Jackson County Continuum of Care, it just is starting to launch a media campaign around stigma and homelessness. So sharing stories, personal stories, with trying to draft messages that can connect both to data and to personal story, because we all look at things really different, is one way that we are on the ground trying to help overcome some of what preconceived notions of homelessness are. I also really encourage our state agencies to find ways to better compare system data so that we can understand the inflow into homelessness compared to the amount of folks that are able to get housed. When folks get housed and have the right supports in place, how does it decrease the medical system, law enforcement system? It actually is a cost savings, a significant cost savings to invest in housing and services. Building housing, providing the services, getting people into that housing is significantly cheaper for our system, but we don't have it at a state or a federal level at all. So if we're trying to create that individual agency by agency or county by county, we're not going to be comparing apples to apples, and so we won't be able to tell the story of the whole system within our state. So I encourage there to be some legislation that dictates we have to really truly understand the impact of homelessness on our economy.
And just sort of building on the theme of we need more support for housing, and we need more flexible resources for affordable housing. I think the biggest challenge I have had in my career is that you can be a kid and you can be couch surfing and have no place to go that you call home that is stable and regular and safe, and you are not homeless enough to qualify for most affordable housing programs and supports that are out there, and that drives me nuts. So how much trauma does a young person have to experience before they have had enough bad things happen that they now qualify as homeless, because the federal definitions around homelessness are varied. There is not one definition. There's HUD's definition, there's education definition, and the state has, you know, a myriad of definitions that kind of all come down to your local COC, and I'm grateful our Jackson County COC has recently just unified a definition that includes children and families and seniors, and I'm so grateful for that, but that is not true everywhere. And so flexible funding allows, if you didn't fit that narrow little, you know, scope that allows for funding stream A, that there's other options. And right now, there's not a lot of that.
Oh, you go, then I'll go.
Okay. Yeah, on the, I feel very loud. On the micro level, like making sure it's about the individual and what the individual person needs, that's probably not gonna work for the senator, which is fine. Protecting Medicaid is huge. When I mentioned our THWs and the work that our peer support specialists do, our case management, that's recognized by our CCOs and Oregon's 1115 model as, or 1115 waiver as being an important part of the delivery model, and that's part of the role that shelter and housing have in creating healthier communities. Those services are reimbursed. We would love more reimbursement, but we also, it would be very, very difficult to be able to do this work if we were to lose the ability to serve both the Medicaid population and the expansion population, at least not at the same level we are now. It's also part of the reason that we are able to expand from about 100 units to about 500 units over the past 7 years. Those units are also full. One of the things we learned during COVID is that a full hospital is not a particularly effective hospital because it doesn't have any capacity for new crises or new pandemics or new needs. If there's a bus crash, that bus full of people can't go into a full hospital. We're kind of dealing with a daily bus crash in our economy, and that's that we have so many people that have so much need and there's nowhere for them to go. Rather than continuing to expand the low barrier to entry shelter model, what I would much prefer to see is continuing to expand housing that has supports for people to get into it, makes it as easy as possible for people to come in at the level that they're at, particularly if they have physical disabilities, so that more people can move out of the shelter, so the people who are on the streets today can then move in. And that's kind of how I see that continuing to develop.
I want to kind of ping on the data conversation as well. The point in time count, I'm just going to be honest, it's garbage. It does not count people where they really are. One day, imagine if that was the census for the United States. Like one day, volunteers for the most part during business hours in January. If you're unhoused in January and you have any money at all, that's going to be when you're going to be trying to be inside somewhere. I also found in my own survey that people tend to go to places where they know homeless people will be, so they'll go to shelters. But many of the people who are unhoused and trying to pass for housed are not in shelters. So we really need to revamp the point in time count because money follows the pit count. And funding follows the pit count, and it's inadequate by at least half. So we really, really need to invest in that and revamp it. And the other thing that came to mind is that typically HUD funds for 6 months in emergencies, and 6 months isn't enough time to get on your feet, not even close. Not in this economy, not in the housing shortage that we have. It's closer to 18 months. So can we please talk to them about that as well? Thank you.
I guess I'd just like to add one more. I think Sam spoke to this a little bit around the continuum of housing options, and Mary spoke to not to families or individuals that are experiencing homelessness have the same experience. It also means that the interventions that we all need are very, very different. We have to be able to have different interventions for the folks that are in need of those services. Transitional housing is a critical service for those that need it, and hardly any of the state or federal funds are available to support that type of housing intervention. It is really, really important that transitional housing be brought back up to a priority.
Thank you all. We're going to wind this down with just a couple minutes left. I'm going to give the panel last word in a half minute or less. Any final thoughts? Anything that was left out that you feel is important to say?
I'll just end it with just one more story that's very short, but there's a lot of assumptions from people who don't know better that what people experiencing homelessness want is just stuff and a handout. And one home visit that I did to a campground out in the sticks out here earlier in my career to a 6th grade boy who had been out of school for several weeks. And when I got there, his mattress was just on the ground with a blue tarp over it. It was raining, and he had a flashlight, and that's how he was doing his homework. And when I asked him, because it was coming up to Christmas and we had sponsors for a holiday program, like what he might want, the only thing he asked for was the next book in the Harry Potter series. So just to remember that people experiencing homelessness have the same wants and needs that the rest of us do. They're not always just looking to get something for free or to have resources. They are just looking to survive, and in some cases, read the next Harry Potter book.
You made me cry a little bit.
You can follow me.
That's a hard one to follow.
I know.
And I got it for him.
I guess I'd just like to say that I think that, and I think about this a lot, there's a lot, and Mary and I have had this conversation several times, there's a lot of talk about self-sufficiency and getting people to that place of self-sufficiency, and none of us are self-sufficient. I know that is a term that means something, but we all rely on each other, and I think at the foundation of the reliance upon each other is that we have care, we have a system, we have people we can fall back to, and most people that find themselves experiencing homelessness don't have those levels of supports in place to catch them when they need them. I think there's a lot of people in this room that have been caught by their loved ones at one point or another, and if they hadn't had that system to no fault of their own, they would be having the experiences that we're here to provide to those others. So I think that's a really important thing for us to acknowledge and to understand that we all have, maybe we don't all, but most of us probably have somebody that has helped us in a way that we will never forget, and we're here to support those that may not have that now.
When I used to work for the food bank, we would always talk about putting ourselves out of a job. That was the goal. And one day, somebody came up to me after an event and said, "You've got to stop saying that." And the reason you have to stop saying that is that if you didn't exist, the emergency food system, she would never have been able to leave her abusive husband with her daughter. Because no matter what else she had going on, she knew she was going to be able to feed her kids and herself. And she needed that reassurance so that she could leave. And so the idea would be that our programs are largely empty, that they're smaller, that there's much, much less work for us, but that the safety net exists. And with the medical respite program, what's been fascinating about that is the way that it's been used that we never anticipated. We've had folks that have been waiting years to get an ankle surgery, but they didn't have a safe place to prep or recover. We've had people who are in their 60s that have never had a colonoscopy and really, really should get screened. Because again, it's going to be much more complicated, much more expensive if it's caught later because of an emergency. But we've also had a number of people who have a home, but the reason they can't safely discharge from the hospital and go back home is because home is where the injury occurred, because it's a domestic violence situation. We are not set up to do that exactly, but there's also no reason that we can't be a domestic violence shelter. And in this case, what's happened is people are discharging from the hospital, recovering physically, while they're being referred into Dunn House or Women's Crisis Support Team or another program that's a specialist for that. And looking at the way that our programs are being used by the people who really need them continues to kind of drive the growth and change that we need to do so we stay relevant to the people's needs.
I guess I'll just use this example. We are swimming in data. What we are lacking is understanding. It's how do we take that data and put it together to form the picture of how this happens and how we got here. And I think that's really important, and it speaks to everything that everyone here has talked about, right? Like understanding what happens to us as individuals, as a community, as a nation. I live in terror that the shitty little support systems we have now are going to go away. And then more and more people will find themselves on the street. And we just can't keep stigmatizing. So I guess I would say, if it's happened to you, tell other people. Let's come out of the shadows. Let's not be ashamed about our lived experience and our struggles and our difficulties. Actually, wear those as a badge of reality and courage, because you're still here. Encourage others to do the same. Let's talk about it. Let's quit not talking about it. Let's not say we're fine when we're not. Let's not say everything's tickety-boo and I've never struggled, because we have. And maybe that will help us all to understand each other more and be more willing to reach our hand across and help each other. It's kind of corny, but it's where I'm coming from.
As I said at the beginning, this is a pretty incredible panel. And of course, we just barely touched the tip of the iceberg when it comes to this issue. Please take the chance to introduce yourself if you have additional questions. These are amazing people that know a lot of things. One more time, please show your appreciation for their time today.